So we talked a little bit about this, why childhood obesity starts before birth. And the lifestyle changes that most people talk about as the first step in childhood obesity management or adult obesity management really might be more effective in, again, the adults of childbearing age who could then change or modify or limit the epigenetic changes, and thus their children would have less risk. But once you are born, lifestyle changes, diet and exercise really don't work for children. And they don't really work for adults either. But they're both better suited for prevention efforts. And frankly, something we should all be doing just to optimize our own metabolic health. But in children, there's something called IHBLTs, intensive healthy behavioral and lifestyle treatment programs, IHBLTs. It's on our CDC website. And they are these programs that require 26 contact hours with a provider, and they're diet and exercise focused. And as you can imagine, 26 hours means, an hour a week for 6 months, or an hour every other week for a year, which is a lot of time to put in. And the data from those programs show that they achieve about a 5 to 7% total body weight loss. So 5 to 7%, if you weigh 300 pounds as a 15-year-old, that's 21 pounds. So now you weigh 279 pounds. Kilos is 150 kilos down to, let's say, 135 kilos. It's just not enough to treat the disease of obesity. It definitely makes the patient metabolically healthier, but it does not cure or adequately treat many of the other comorbidities related to obesity. So lifestyle changes help, and especially help in prevention, but as a standalone treatment, they don't really work very well. And obviously, the sort of public health efforts that use a one-size-fits-all approach to obesity prevention really don't help the majority of people when it comes to treatment, and it's even questionable how well it works for prevention. But again, the take-home point here is young adults and then in utero environment are critical to both the kid and the parents. And taking it a step further, if you are young adults who have had some metabolic health issues that you've worked on and treated, when you do have that kid and that kid's born, now that kid is born into a family that already knows about metabolic health and already is working on lifestyle changes. So it does still, provide a better environment or a healthier environment for that newborn to be born into. So no matter how you look at it, it's really the metabolic health of the family unit is what we're talking here. And all obesity work in children is a family affair. The whole family has to be involved. And if there are grandparents in the house, then it has to be, 3 generations, not just 2. So it is a overall team effort from everyone who's involved in the kid's life, and everyone needs to be educated on how important it is.